Honorable Prime Minister of India, our illustrious son of the soil, Dr. Sen, my colleagues, Mr. Kapilji, Srimati Lakshmiji, Secretary Health and Family Welfare, Mr. Hotaji, sorry, Dr. Fleming from the Gates Foundation, and of course our ever young Rajatji, Dr. Reddy ji, members of the governing body, stakeholders, friends, ladies and gentlemen. I wish you all a very good morning, and I would also like to welcome one and all for attending this inauguration of the Public Health Foundation of India. We all know that health is a very essential resource, much needed for the country's development. And there's little doubt that both health and education are the pillars of a nation's macroeconomic development. And for my Prime Minister, health, education are like both his eyes, and agriculture his heart. As India advances rapidly in the global arena, attracting substantial optimism worldwide, the time is propitious for us to strengthen our fundamentals and ensure a sustainable, long-term development platform. Our Honorable Prime Minister has most appropriately said that his first and foremost priority is to complete the unfinished task that the founding fathers of our republic had set for us at the time of independence, that is, to get rid of chronic poverty, ignorance, and diseases. The National Health Policy 2002 envisages the need for a more holistic approach in the national public health initiatives so that there is equitable access to the health facilities for all. It also recognizes the need for improved financial resources and better managerial capacity in public health to reduce the disease burden through preventive and promotive activities and awareness programs. The health needs of our country are enormous as we continue to face the burden of infectious diseases like tuberculosis, malaria, HIV/AIDS, and the new problem which we are going to face of chronic diseases like diabetes, cardiovascular, strokes, cancers, mental health disorders. And of course, we all know that today the life expectancy in this country is 63, and it's expected to go to about 75 in the next 15 years, where we're going to have a lot of senior citizens in our country. So we have to take care of them. And we have to strategize our priorities and programs according to the necessities of that point of time. In this context, I would like to say that a number of new initiatives have been undertaken by the Ministry of Health and Family Welfare with the idea of transforming the state of the health in this country. Over the last 2 years, we have embarked on an ambitious change agenda, cutting across a variety of themes that would not only have grassroots impact, but also impact at the highest policy levels. The National Rural Health Mission aims to strengthen health delivery in rural India and to ensure that there is a measurable ultimate impact on the key health indicators like the infant mortality, maternal mortality, and the total fertility rate, that is population. At another level, we are in process of substantially increasing the scale and revamping the quality of medical education in the country to make it more practical, more rural-oriented, and more social-oriented. We aspire to impart greater thrust to continuing medical education as well. At a still higher level, we are working towards policy and regulatory changes around an integrated food law, and we'll be soon having a national drug authority in this country. And of course, we're going through a process of accreditation of hospitals, medical educations, and so on. Therefore, from grassroots capacity building interventions to highest level policy and regulatory changes, we envisage a spectrum of interventions. It is an exciting opportunity to be part of this critical nation building process. The question then is, how do we continuously translate the concept to reality? How do we make it happen? As some of my private sector partners in this audience would say. I believe that there are 3 things that we need to work in order to achieve our aspirational agenda. Firstly, we need to impart a much greater degree of professional management into our work and practices, systems, processes, and a culture that are stakeholders focused rather than internally focused, efficient, and responsive. Secondly, we need to collaborate extensively more than ever before, as it is a well-known cliche that health needs a multi-sectoral response. So we need to engage both within the government and outside in crafting an innovative response. We need to proactively engage with the private sector, less for resources, but more to draw on the innate spirit of performance, execution, and entrepreneurship that prevails in this sector. We all know that in India, it's a wide disparity between the private and the public health infrastructure. And in the public infrastructure, we have just 20% of it, the rest 80% in the private sector. Hence, the notion for a public-private partnership is extremely pertinent in our change agenda. Thirdly, we need to have the courage to innovate, to embrace change, to welcome new ways of working, and to carry with us the wisdom rather than a prejudice of experience. If only the people of this country had some basic knowledge of public health, 60% of my budget would be avoided. And I think this foundation is one step towards achieving that target. We all know that all the most advanced developed countries who are successful in the health sector have a string of successful public health institutions like what we are going to start today. And I'm sure once we start these institutions all around the country, we are going to go head on, take up this huge problem of public health. The Public Health Foundation of India initiative, in many ways, to me, symbolizes the kind of initiatives that we should be undertaking going forward. It is indeed a breath of fresh air. It is ambitious in its scope. The spectrum of people in the audience is reflective of the spirit of participation and collective interest that this has generated. It has shown the promise of taking a concept that has been in the air and in several reports for years now and actually turning it into reality. I commend the efforts of all those who have been involved in this effort, and I have seen this evolve rapidly over the last year. We are very supportive of this effort and look forward to this partnership. I am personally committed to ensuring efficacious and expeditious support to the PHFI. I invite the wide private sector community, like Dr. Fleming had said, all the state governments, the academic community, civil society groups, and the international community to join hands in shaping this effort and a spirit of refreshing enthusiasm and collaboration leading this nation for a common goal of quality health for all. I give my best wishes in anticipation of an era of transformation in India. Thank you very much.